This presentation is made possible by the Association of Professors of Gynecology and Obstetrics Medical Education Endowment Grant. The content is solely for educational purposes and does not necessarily represent the views of the Association of Professors of Gynecology and Obstetrics Incorporated or Western Michigan University. Homer Stryker, MD, School of Medicine. Case 2. In this scenario, 20-year-old prima gravida, married young woman who presents to labor and delivery early in the second trimester.
So what brings you in today?
I had a bunch of watery fluid come out of me about an hour ago, and since then I've had really bad cramping and waves.
Okay. How far along are you in your pregnancy?
I think about 20 weeks. Is this normal? I just came in last week for a checkup.
Well, we'll do some tests and some examinations and try to find out what's going on, okay?
I really hope my baby is okay. We've already gone through so much. This is my first pregnancy, so I really don't know what to expect.
Okay. Have you had other complications along the way?
No, so far we've actually been blessed to have a really great pregnancy, but my husband and I are really anxious. It took us over a year to get pregnant. My doctor prescribed us these pills to help us conceive, and 3 months later I missed my period and I knew I was pregnant.
Okay. We'll do a pelvic examination and find what the source of the fluid is, okay?
Okay, thank you. Come in.
Dr. Smith.
Hello.
I'm the on-call physician for the group. I understand from the triage nurse that you're leaking fluid?
Yes, is everything okay?
Well, according to the examination, it sounds like your bag of water has broken, and you're about 2 centimeters dilated. And according to the monitor, you're contracting about every 2 to 3 minutes.
What does this mean?
So it means that you're in preterm labor and you could deliver the baby.
So how long will my baby need to be in the hospital if I deliver right now?
Well, based on how far along you are, it's too early for the baby to come. It wouldn't survive if you deliver today.
No, my sister had something similar happen. You can give me medicine to stop this labor, right? Like a shot of something. She said there's some type of medication to help if people deliver too early.
I know this is really hard to digest, but that's a medication that the baby would have to be further along for it to work.
Are you telling me we're just gonna let my baby be born and die? No, we have to do everything to help my baby live.
Later in the day, the patient's contractions decreased in frequency, and she is no longer feeling them. After the patient has been counseled by the on-call neonatologist on the 0% chance of survival at this gestational age, she has agreed to remain hospitalized until 23.5 weeks. If she is still pregnant, she will receive steroid injections to help her baby's lungs mature. On hospital day number 3 of her admission, she develops a fever and abdominal tenderness. Blood cultures are positive for bacteria, and the patient's vital signs begin to deteriorate.
So the reason you're getting sicker is because you've developed an infection. It's called a chorioamnionitis. It means that there's an infection in your uterus, kind of like an abscess. Unfortunately, the child can't survive with the infection, so we need to induce labor. Unfortunately, it has a very low likelihood of surviving, but if we don't induce, your you have a possibility of losing your uterus and not being able to have a child ever again.
I thought we talked about this. My baby cannot survive yet. Isn't this an abortion? I'm a Christian and this is not an option.